the last part of this question, next, some of my MDs who don't believe in fibromyalgia because the lack of studies and research. I feel like I'm fighting against healthcare professionals as well as the fibromyalgia stigma from the general public. What's your recommendations on how to handle these situations? Is there any definitive research in the works to prove fibromyalgia is real and what causes it? How close are we to a blood test? Any research or studies on the guaifenesin protocol? Yeah, and so for me, when I see medical professionals, I'm always sticking out my elbow because some of the last nodules to go on the guaifenesin protocol are the ones in the elbow, and I've got these scrawny arms and my nodules stick out, and so I'm always having people palpate my elbow nodule, healthcare professionals, things like that. I probably will be sad when that nodule finally passes away after guaifenesin, because what am I going to do? And when I map people and make a notation of where their nodules are, I tell them the areas where I think their primary care provider would be most likely to feel the swellings. And often that time that's in the inguinal ligament area, and that's the area that goes from your hip to your pubic area, and it should be the size of a string. And most people with fibromyalgia, untreated with guaifenesin, it's not a string, it's hugely swollen. That nodule is huge, and oftentimes 10 to 20 times enlarged. And I've had a couple patients have it removed because their doctor's like, what's that swelling? And of course it grows back. And there are other swellings that, especially in the hip area, that's so large. And in the shoulder, the problem with the shoulder is that there's a lot of muscle spasm in that area too. It's amazing how many physicians who treat fibromyalgia patients don't touch their patients. So regarding the study results, the email that I sent to Annette has a list of studies, and that can be pretty important for you just to say, doctor, here are a list of studies that show the unique findings in people with fibromyalgia. And bless their hearts, there are a number of doctors throughout the United States that study fibromyalgia and publish results. And Dr. Daniel Claus, one of my heroes, and Leslie Arnold in Cincinnati. And on the email list, they wrote a white paper called Fibromyalgia and Chronic Pain Syndromes. And they basically say, numerous imaging studies have demonstrated multiple specific central nervous system changes related to central sensitization. And so that means that we feel pressure as pain. And these data and others imply aberrant brain neurotransmission as the hallmark of fibromyalgia. And these studies, and again, they're like 20 that I listed here that show that there are, we feel pressure is pain, that functional MRIs show that when pressure's exerted on our arm, that the pain centers in our brain light up. There's altered brain conductivity in people with fibromyalgia, higher glutamate levels in the brain, different levels of serotonin, norepinephrine, and tryptophan, lower in people with fibromyalgia. MRI SPECT scans showing decreased flow in the thalamus in people with fibromyalgia. So, and this is super important, that to know that there are hundreds of studies. If you Google fibromyalgia studies, you'll get 100 really good studies. What I'm very interested in teaching physicians is that there are non-brain abnormalities in people with fibromyalgia, because let's say you get someone like these wonderful doctors who understand fibromyalgia. They think it's all altered pain processing in our brain. It's not just that. If you take a look at the list of the common symptoms, how can brittle nails, easy bruising, and rashes be altered pain sensation? No. There are a lot of things that are not just because the dial of our pain is turned up. So I've listed non-brain physical finding studies on this list. There is a link between fibromyalgia and irritable bowel syndrome because of an abnormal lactulose breath test in people with fibromyalgia. There's altered intestinal permeability in fibromyalgia. A lower amount of intramuscular collagen in people with fibromyalgia. Transcapillary permeability is reduced in fibromyalgia, meaning that probably less able to get blood flow in and get waste products out. And get this one. During exercise, muscle oxygen extraction was less in fibromyalgia patients, and recovery time, it took longer for oxygen to normalize in the muscle compared to people with fibromyalgia. So, so we're ahead of our time here, meaning those of us with fibromyalgia, we know it affects every organ in our body, and with time, people are going to understand that. There is a physician in Colorado named Dr. Meg McDonald, and she recently found the guaifenesin protocol, and she is feeling better after just 9 months. She is a military doctor, and her specialty is in research. She came to see me a few months ago. I taught her how to map, and she said, would it be okay if she did some studies on fibromyalgia, the guaifenesin protocol? I said, yeah. So she has the background, she has the interest, and so I checked in with her last week because I said I was coming to this meeting, and she has a list of about 20 things she'd like to study, and she's meeting with Dr. St. Amand on Monday and Tuesday, and he's going to also go over mapping with her. We need to really get papers published, starting with simple things like case reports that Dr. St. Amand and I have. We've got thousands of people who have fibromyalgia, not just with a nodular exam, but have been diagnosed by rheumatologists, neurologists, primary care doctors, that are improving on guaifenesin. So for me, I think that is a very, very, very positive thing, and I look forward to helping her with her work.